Testing. Testing. Okay.
Perfect. Yes. Yeah, I know. They're lucky to say it. All right, get started here. Thanks everybody for coming on Thursday of finals week. Excited for the opportunity to introduce Dr. Alexis Adams Clark. Dr. Adams Clark initially completed a bachelor's degree in psychology and gender and studies at Connecticut College. She completed her bachelor's, she went on to receive her doctorate in clinical psychology at the University of Oregon and is currently a postdoctoral research fellow at the Warren Alpert Medical School of Brown University. Dr. Adams Clark is also an adjunct instructor at Wheaton College in Norton, Massachusetts, covering coursework in statistics and human sexuality. Her research interests broadly involve violence and trauma-related psychopathology, with an emphasis on the impact of interpersonal factors, institutional context, and cultural norms on responses to exposure. The title of her talk, Trauma and Context, Institutional Influences on Recovery and Risk After Sexual Violence. That's what the title of her talk is.
Thank you. I've never used like a cute little microphone like this before, so I'm not sure how loud to talk. Thank you. Someone flag me if it's like too loud or something. All right. So thank you for that introduction and thanks for having me. So what I hope to talk about today, I am going to briefly introduce essentially like a general socio-ecological framework that I use to kind of conceptualize trauma and in particular sexual violence. I'm going to talk a little bit about a theory of institutional betrayal. I'm going to highlight some key empirical findings about this work and talk a little bit about what I envision to be some future directions for myself. Alrighty, so some folks are probably very familiar with these like concentric circles, where we have Bronfenbrenner's ecological systems theory. This is like a simplified version of them, but I want to start with this just because This model kind of informs how I think about trauma. So trauma being not just a result of these individual level factors. So how people respond to trauma, sure, is predicted by how much self-blame folks have, how much avoidance they might engage in, but is also predicted by their interpersonal relationships, how much support they have. Also, all of this occurs within the context of memberships and institutions, as well as larger sociocultural norms. I am going to mostly focus kind of on this institutional piece, but like to start out by kind of acknowledging some of these other factors at these other levels. All right. So most folks are also probably familiar with these statistics. 1 in 5 college women, or 1 in 4, depending on who you ask, and 1 in 16 college men will experience sexual violence while enrolled in college. Let's see. In the past year, there was actually a study in the Journal of American College Health that found that among 61,000 college women that they analyzed data from, that across a 6-month period, the risk for college women experiencing sexual violence is actually 74% higher than non-college women of the same age. And that's actually a little bit different than how folks have been thinking about this in the past 5 or 10 years, when the risk was kind of relatively equal, or even some folks thought that non-college folks experience higher risk. But according to this kind of new data, across kind of the past decade, that is not actually the case. So, of course, these statistics matter really because sexual assault is associated with a range of negative outcomes. So probably don't have to list them all out, but post-traumatic stress, depression, anxiety, physical health problems. And when we're thinking about college students in particular, also impaired educational and academic outcomes. So lower GPA, lower class attendance rates, higher dropout rates. So my kind of appeal to folks of all disciplines is really, if we are caring about supporting student success in any way, we really need to be paying attention to the issue of sexual violence on college campuses. And still, with all these statistics, underreporting being extremely low is not a surprise. Most people will not report to any official university or legal service, and half of folks generally won't tell anyone about their experience at all. So we can see why this might be the case for college students in particular. If we look at the results of a little Google search I did like a few weeks ago, just from news articles in the past year. So the university environment, which again is often like heralded and kind of marketed as a place of support and safety, has this reputation for being negligent and even somewhat hostile towards survivors of sexual violence. This got a lot of press attention in about like 2014, 2015. Obama released a Dear Colleague letter to universities saying, hey, remember, like under Title IX, you're actually obligated to intervene on sexual violence. And suddenly a bunch of universities became under investigation. As we can see in the past year, although kind of public, widespread public attention has kind of dwindled on this issue, there remain significant news reports of these very same things 10 years later. So intuitively, we can probably imagine like how harmful this might be for folks who experience violence or even read these news articles about their university institution in the press. But at least in my view, sometimes as psychologists, right, we don't really have the language for necessarily thinking about how some of these larger actions actually kind of seep down into individual well-being or psychological constructs that we study as psychologists. So this is where this idea of institutional betrayal comes in. So this refers to essentially harmful actions or inactions that are perpetrated against an institution to its members, and especially those members that trust and depend, which I'll talk about in a second. But I'm just kind of want to locate this in what I see as this broader institutional context within that kind of surrounds an individual survivor. All right, so some important aspects of this definition I want to highlight is these can be overt actions. So acts of like commission, like someone is actively committing some form of harm. So this is usually like what gets into like public press reports. So, someone actively retaliating against a survivor, someone forcing the survivor to leave the university. So they're like actively committing some wrongdoing. But it can also be inactions. So sometimes inactions are extremely loud and very impactful. So potentially things that a university is required legally or has promised someone that they would do, and they're not following through with their obligations. And secondly, this trust and dependence piece I want to highlight. So it's not just that like institutions do bad things, because sometimes they do. But what, in particularly in this framework, is particularly noxious is that institutions might commit a wrongdoing, and the person has a lot of trust in an institution and or a lot of dependence on that institution. So we can think of a lot of people going to college or university trusting that a university will take care of them and provide them resources if they need them. We can even think about a university as a really important part of someone's identity. I can't remember who I was talking with today, but somebody told me that a strength of the University of Wyoming is that there seems to be a lot of people where the university is really closely tied to their identity. They're really proud of it. They'll wear the t-shirts even if they don't know anyone who goes here. And if that is the case for you and you enter into this university system and you are harmed in it, ooh, that's a really difficult situation to be in. If you're also dependent on them for, say, access to education, healthcare, maybe even employment, you can't necessarily leave the same place where potentially you're being treated really poorly. And this kind of dynamic is essentially theorized to be this difficult bind that is particularly harmful when someone already experiences an act of sexual violence. Then their institution treats them poorly and they can't leave, or it really violates an important aspect of their identity. So it's a dry climate here. I'm going to be doing that a lot. Okay, and this can apply to other types of institutions as well. So I focused a lot on universities, but other folks have applied it to, say, military systems. So we can think of like our band of brothers. Some other institutions like maybe folks don't have a lot of trust in, but maybe they're required to go through them. So if we want to get medical assistance, we kind of have to go through the healthcare system. Like we don't have any other choice, which might make it particularly toxic if our healthcare provider treats us poorly. Some folks have talked about this in relation to religious organizations, but essentially the process kind of at its core remains the same. This institution is either trusted or it's the only resource for protection, and the person is harmed within the context and the institution is failing them in some way. All right, so this is going to look different based on what institution we're talking about. In relation to campus sexual violence, this might look like continuing to endorse organizations that have clear reputations for sexual violence. So we might think of, universities really promoting or heralding their Greek life system, and even some D1 athletics that have very strong histories. This might even look like some prevention programs that like are outdated, like really are irrelevant, like everyone kind of thinks that they're a joke. And imagine what it's like to kind of sit through like these like kind of hokey prevention programs that are not really in line with students' everyday experiences, and to be a survivor in that domain and kind of not have people take it seriously. This might be unclear reporting policies or resources, or policies that require mandated reporting in particularly like non-survivor centered ways. Could also be just a complete lack of clarity about what reporting processes even mean. So, like, who do I tell? What actually happens? What information am I supposed to share? What is actually going to happen? Is this person going to get in trouble? All of these might be barriers. And in addition to like overt retaliation, that unfortunately is all too common from peers, faculty, and even staff. So I like to illustrate this just by like my little fictional vignette, which is essentially like an amalgamation of experiences that I've heard from kind of both clinical and research work. So terrible slide because it has a bunch of words on it. Whatever. So for instance, Maya is a 19-year-old sophomore during team celebration. A teammate pressures her into sex she doesn't want. Next day, she feels disoriented, disconnected. She confides in her roommate. Her roommate says, you know, he's really well liked. It would be awful if something kind of ruined his season. She wonders whether to report, but she doesn't know who to talk to, worries she's to blame, and is concerned that she'll get in trouble for drinking alcohol. Her RA tells her the process can be really stressful. She remembers a friend who said reporting, quote unquote, wasn't worth it. Naturally, academic performance suffers, has some difficulty concentrating. And meanwhile, she sees her athletic program continue to be spotlighted in campus prevention campaigns as a model of leadership and respect. So inevitably, she starts skipping practice, avoiding her teammate. So if you're a clinician like me who looks at trauma, like this is what pings out to me that I would look for like on a traditional like PTSD assessment. So, okay, this person is coming in with an event that meets like criterion A trauma. Okay, she has unconsensual sex. I get a little sense of like dissociative symptoms. I have my like self-blame. I have impairment in functioning. Academic performance suffers. Difficulty concentrating, and I got some avoidance, and we're good to go. We have our criteria to meet PTSD. So if this person's in my office, I'm checking these things off. And I might recommend our traditional like, trauma-focused therapy, which could intervene on lots of different things about this. I could, use CPT, like challenge self-blame. I could use different exposure strategies. And that's all well and good. And also, it kind of sometimes, at least in practice, comes at the expense of some of these context factors. If I want to pay attention to these factors around this person, I'm looking at this, like team, like how are group dynamics playing a role? Oh, okay, obviously this roommate gave a really poor reaction to a disclosure. She doesn't know who to talk to. It looks like either resources aren't clear, or at least they're not getting to students in the way that they should. She's obviously not aware of policy, like amnesty. Her RA clearly hasn't been trained about how to deal with this. There seems to be like some historical events in the past where people were treated poorly, and there continues to kind of be this, exposure or like promotion of programs. So we could think about, in addition to this former approach, we could also, as psychologists, intervene on these things as well without Maya having to do anything. And that can have our downstream effect on her individual mental health. So it's not necessarily like, I don't think these can be intervened on, but I think these also can, and we often neglect some of them, in my opinion. All right. So I'm going to switch now that I kind of have this theoretical framework to talk a little bit about some empirical research in this area I've done. I'm going to talk a little bit about just a cross-sectional analysis that I did just to examine like what is the unique contribution of these institutional factors, even when accounting for all of these other things that we know that make a difference in post-traumatic stress. I'll talk a little bit about longitudinal analysis and then some directions. So yes, I'm going to start here. So basically, this study builds from kind of this larger ecological model that I talked about earlier. So we know, again, multiple factors influence post-traumatic stress. We love our self-blame, we love our coping, we love our cognitions and behaviors. We also know pretty decently that interpersonal factors also make a difference. So we know that in general, social support, perceptions of social support buffers against a lot of different negative outcomes. We also know that victim-perpetrator relationship makes a difference. So the closer relationship and the more trust you have in this perpetrator is associated with generally higher negative outcomes. And we also know that how like folks in your environment, so like your friends and your family, respond to disclosures of experiences matter. So if people engage in things like what we call like turning against, which is essentially like victim blaming, or they respond in ways that involve some type of unsupportive acknowledgement, which is essentially like, I'm deeply uncomfortable with what you have to say, and I'm acknowledging that that was bad, and I'm also distracting because I'm deeply uncomfortable. If they respond in these ways, that's also associated with higher post-traumatic stress. And also, many of these may be, kind of confounded with this institutional betrayal, larger nebulous concept. So really, my goal is like, is there? Is institutional betrayal still adding something more beyond these things that we already know? So this data comes from about 300 undergraduates, all of whom had experiences of sexual violence while sexual assault when they were enrolled at the University of Oregon. It comes from a larger study of 1,800 college students. Majority of folks I'll talk about today are cis women, heterosexual, white, European American, and single, largely reflecting the demographics of Oregon, but also, like, of course, affecting generalizability. So folks reported on the most stressing or severe event that they experienced while they were enrolled. About half of folks were reporting on an event that happened in the past 6 months. 50% knew the perpetrator. I'm sorry, involved a student perpetrator. 70% knew the perpetrator in at least some degree. And about 40% happened directly on the campus, and 40% happened within the surrounding, like, immediate local Eugene community. So in line with kind of the levels that I talked to you about, I put in some common measures that, again, we use to predict variance and post-traumatic stress. So I have my little individual-based, that I call them, measures of self-blame, avoidance. I have my little interpersonal grouping of social support, social reactions, these reactions to disclosure, and my relationship to my perpetrator. And then I have this measure that was created, not by me, to measure institutional betrayal. I have it on like a pocket slide at the end if people are curious. But basically, essentially, it's like a checklist measure that goes through and describes certain actions that correspond to this construct, like creating an environment in which this experience of sexual assault seemed more likely to occur, all the way to like covering up the experience, making it hard for you to remain a member of the institution. And my primary outcome was post-traumatic stress as measured by the PCL, with this like index event being the campus sexual assault. And I wanted to control for other types of trauma as well, and childhood sexual violence. Anyway, so among this sample, about 35% of folks, so over 100 people, reported experiencing at least one form of this larger concept of institutional betrayal related to this experience of campus sexual assault, with many people, and I would say the majority of folks, endorsing more than one at the same time. So this is an experience that people are having. When conceptualized both dichotomously, like either you experienced an event related to institutional betrayal or not, and continuously, so I'm gonna kind of count up the number of actions that you endorsed, these things were related bivariately to post-traumatic stress. Prior research has established this, so not a ton new, but glad that this data supported it. Oh, and actually something interesting, especially for clinicians, maybe in the trauma field, of folks who reported institutional betrayal in addition to campus sexual assault had a PCL score like that was about 12 points higher than those who reported campus sexual assault and no institutional betrayal, which is like pretty clinically meaningful to me. But still doesn't really answer the question. So basically, I want to know, like, controlling for all these other things, is my institutional betrayal variable doing something? So simple regression in 3 steps, really kind of modeling this, the first 3 levels of the social ecology. We have our individual level variables, interpersonal level variables, and institutional level variables. I really hate it when somebody puts like a table with like numbers and things up there because no one can read it. I'm not sure this is any better, but I tried. Basically, this is like a visualization of regression coefficients in each of the steps of the model. So the colors represent each of the steps, the 3 steps of the model. The little circle or shape, whatever that is the unstandardized regression estimate. The little lines are the 95% confidence interval. Basically, if it crosses this gray line, it is not significant. If it does not, it is significant. And it's not, I probably should have made it standardized, but oh well, because it's not really like how far right or left. It's really like the estimate in relation to the size of the confidence interval. Anyway, so I tried to spare you that. I'm not sure that I did that well. All right, so basically, here's our little first step of our model, essentially the model with the blue line. We have our like severity of college sexual assault being a significant predictor. We also have our avoidance coping for maybe those more exposure behaviorally based, might be excited to see that. All those predict higher levels of post-traumatic stress. We have our relationship factors. So we have a closer relationship to the perpetrator associated with higher levels of post-traumatic stress. This particular social reaction to disclosure, the like, I'm feeling deeply uncomfortable and I'm going to distract you or make it about me, was also associated with post-traumatic stress. And for me, happy, that institutional betrayal, even controlling for all these other things that might play a huge role, also significantly predict post-traumatic stress. So in other words, like there's a there there. That's really my conclusion. Essentially that each of these different levels are telling me something new about variations in outcomes among sexual assault survivors. And as a whole, actually, again, all the predictors together, these things predicted about 50% of the variance in post-traumatic stress, which like is not nothing, especially in our land of like small effect sizes. All right, so I am going to now talk about a longitudinal analysis that I did. So a major limitation of some of this work that I encounter, one is like the ever-present issue of causality, right? Of like, we don't really know what kind of begets what. But also this issue that I get a lot is like this common method variance issue. So our rate, especially with like cross-sectional research at one data point, like, is it really just like someone having a bad day and they're just like checking off all the negative things that they can check off? So this analysis doesn't really get at the causality piece that much. But really, I wanted to establish that the time that I measure institutional betrayal essentially has relevance both 3 months and 6 months later on distress for these folks. So I predicted that it would. So I predicted that when I measured folks' campus sexual assault and institutional betrayal at this time point 1, that these differences would maintain across time. Alrighty, so what I did, really, I don't expect anyone to like read this, and I'm not going to read it to you. I just put it up because I'm like impressed with myself for like figuring how to do like something fancy and complicated. So basically what I did with like my prior sample was everyone who endorsed having experience of campus sexual assault received a prompt to allow permission for me to contact them via email in 3 months and 6 months. And I also prompted a random sample of 25% of folks who did not endorse an instance of campus sexual assault, so I could have like a little bit of a comparison group across time. And really, this resulted in me following up with about 147 of them, 76 of whom had these kind of baseline campus sexual assault experiences. Oh, and I kind of used actually this methodology to like do a separate study that's actually in press about like kind of counteracting some claims about bias in survey methodology, about who volunteers for different surveys among sexual assault research. So, but I won't really talk about that. You can check it out if you want. All right, so among the 76 folks who had this campus sexual violence exposure at this baseline, I did a bunch of kind of fancier things, but also I always find kind of simpler analysis to be quite parsimonious and kind of most impactful. So these folks in blue here are folks who endorsed at least one instance of institutional betrayal. And these folks in orange are, again, still had campus sexual assault experience, but no institutional betrayal. So our institutional betrayal at this time one, oh, I'm like using the mouse and I realize you guys can't see what I'm talking about. Okay. At this time one, basically, unsurprisingly, institutional betrayal was correlated with both distress at time 2 and time 3. And these group differences remained at each time point, although like in my second follow-up, it seems to diminish a bit, which is promising, but still was statistically significant. I couldn't figure out how to put error bars on the thing. And anyway, so in a multi-level modeling framework, really this means like there were differences in intercepts. The group started significantly different, and there were no differences in slope. So basically they started different and they remained different. I also, interestingly, folks who had this institutional betrayal experience had about average PCL scores, at least at time 1 and time 2, that were above like a cutoff of about 32 or 33, which is like usually this like clinical cutoff for like probable PTSD. All right, and then I think it's quite powerful to look at these two groups. Confusingly now, institutional betrayal groups in green, oops, in comparison to folks who have no campus sexual assault history over time. So again, my green line here is campus sexual assault plus institutional betrayal. My blue line is campus sexual assault, no institutional betrayal. And my orange line are folks who had no campus sexual assault. And probably what sticks out to you is that these folks are looking, like the blue and the orange are looking much more similar than the blue and the green, even though they both have campus sexual assault histories. So my takeaway really is that this might be a key factor among sexual assault survivors who have higher and lower levels of distress. Essentially, these differences are maintaining across time. All right, and then when I was on internship, I got a small like seed grant from Brown to do a qualitative follow-up with about 15 of the folks who were in this study and who had both campus sexual assault and institutional betrayal experience. I'm like currently analyzing data, but I just wanted to throw these quotes up here because I think that they kind of add personal perspective and experience and voice to some of these experiences that I'm describing very quantitatively. So this one on the left, I think, is like a good example of like what I would say omission or inaction. So this person said, there have been multiple events happen at a frat party. Even though I feel like a lot of students in the past have done a really good job of advocating for safety at events, they say use the buddy system, never go alone and don't get separated. But things happen, and I was sober when I went there. I went with a friend. I didn't really have anything valuable. An incident like that still happened, and that's very normalized. People I talk to have always been like, yeah, that happens. At least that's just part of what happens. I mean, they didn't discount my experience, but they definitely were like, no, it happens to a lot of people. It happened to me. It happened to everyone I know who's gone to one. And yeah, I think perpetuating culture like that, or maybe not perpetuating it, but not condemning it. So I just really like this participant's phrase of like not condemning it. And students are really smart and they know when you don't say something. And then this one on the right is a more kind of traditional example of commission. So this person says, I think for me, I did have to report it to a professor because I had a midterm at that time. And basically, he was like, it doesn't matter. You have to keep up with the term. Otherwise, you're getting a 0. So, okay, in every case that I've been, they've never actually provided any punishment to anyone. They've always found a way to have the person not get in trouble. And again, it's all based on them saying that there's not enough evidence. Maybe only having one interview with an investigator, which I don't think is enough for a situation like this. Obviously, in stressful events, you'll forget and remember them later and things like that. So that is where my research about institutional betrayal is, as I'm starting to analyze this qualitative data. But I just want to also kind of put it in the context of some of my other work that kind of combines multiple layers. So I'll just go through this really quickly just to give you a sense of other things that I do. So I've done a little bit of work on disclosure reactions, so those interpersonal disclosures among LGBTQ folks. I've done some work about disclosures online and privacy to those, which kind of is very relevant post Me Too. I applied this framework to COVID-19 procedures during the pandemic. So kind of similarly, like a university advocates for protecting the health and of their students, staff, and faculty, and also many people within the context of that institution have various experiences and might be essentially feel betrayed by how the university acts. And this received some press from Oregon Public Broadcasting. I've done a little bit of work on this in particular type of harmful interpersonal reaction to being accused of wrongdoing. That comes with a fancy acronym called DARVO, where they deny, attack, reverse, victim, and offender. Basically a harmful way to respond if someone accuses you of doing something wrong. Mentioned on South Park, if anyone wants to check it out. Some institutional messaging work, some high school harassment work, some work related to both sexual functioning and non-consensual condom removal, and have been recently funded under a grant that is just doing some qualitative stuff about firearm violence, which is a new kind of area of violence that I've learned a bunch about. Okay, that's enough of that. So basically directions for my future research and like, what do we actually do with this information? So within my little kind of small network of institutional betrayal scholars, we have this idea of institutional courage. So essentially this is viewed as this like antidote to institutional betrayal. So essentially this like an institution's commitment to engage in moral or transparent action despite short-term consequences, which may be financial or reputational. So really centering and prioritizing folks' need, responsibility, transparency, care. This might look like a lot of different things. This might look like any of these, but I might highlight what might play a role in campus sexual violence. So to me, complying beyond civil rights law, so not just like having the training and like checking the box, but actively like engaging with the spirit of this. Educating folks about, especially leadership, about some of these processes. And in particular, like we're psychologists, we know how to teach behavioral skills of like, how do we actually respond and like rehearse responding in a supportive and effective way. Oh, that was number five. I stole it. And also, like bearing witness and having accountability for historical wrongdoings. These make a difference to people. If an institution has had a reputation of mishandling it, they might have said they like change things, but are they actively making amends for these wrongdoings? Are they apologizing? Are they actually listening and like bearing witness to people suffering? And also like engaging in scientifically valid climate surveys that are anonymous and that people like feel willing and are incentivized to complete. So going back to this, I might think a little bit about how some of these aspects might play a role in this fictional person's experience of, training community members, friends about how to respond to disclosures, making reporting policies really clear. Again, we know how to break down tasks as psychologists into manageable and understandable pieces. We could probably do that with different policy and decision-making practices that make it much more clear. We can also make it more obvious about alcohol amnesty policies. We can train RAs RAs receive a lot of training to respond in practice disclosure responses. And we could actually like make amends for historical wrongdoings and kind of rethink how we might spotlight different groups or organizations where there might be histories of wrongdoing. So I want to highlight just two pieces of data that kind of have some early evidence for how some of these actions might kind of disrupt institutional betrayal. So this is from a study that was done among like folks who are in the workforce and who also were filling out surveys in Amazon Mechanical Turk, but they also had to have like full-time employment somewhere else. Maybe they were doing it while they were employed. And what we measured was experiences of workplace sexual harassment. And we measured both institutional betrayal related to these experiences, as well as some of these more supportive or like courageous actions of the workplace environment. And we measured its influence on different workplace outcomes. So I think here, yes, I have like affective organizational commitment. So basically like how emotionally connected do we feel to our workplace? And what this little fancy thing is showing is basically that for folks who had workplace sexual harassment, they had high levels of institutional betrayal, but low levels of these supportive environments. Institutional betrayal was related to lower affective commitment. But for folks who maybe had institutional betrayal related to these experiences, but they also simultaneously had some of these supportive or courageous actions, this association was no longer present. So to me, this is like, okay, we might not be able to get rid of institutional betrayal actions, and also maybe we can kind of counteract or buffer against them by promoting more supportive or validating actions. So I replicated this interaction in a different sample of campus sexual assault survivors, different than the one that I described before, but basically the same kind of pattern held true for folks who had high levels of support, even in the midst of these kind of institutional betraying experiences. There was no relationship between betrayal and trauma-related symptoms. Folks who only had like moderate or low levels of these kind of courageous or supportive actions, there was still a significant relationship between betrayal and trauma. All right, so my takeaway, if betrayal exists, we might, again, be able to kind of counteract some of it in other areas by promoting support and courage amongst different aspects of the institution. And where I hope to go from here is so I spent like a lot of my work thus far has been a bit like observational, mostly trying to like convince people like I think this matters, like there's a there. What I really want to do next is one, kind of up the rigor of some of my data collection. So I'd really like to like kind of hit the ground running with like either like a daily diary or an EMA protocol. I'm kind of getting a lot of training on that on postdoc and kind of want to think through about how to maybe get a sense of how these are showing up like in people's daily lives. Because right now it's like a bit of a nebulous construct. I also want to test some aspects of theory, predictions by the theory. So are folks in particular the ones who are most impacted by this? Are they the folks who maybe come into college like really attached to the institution? It's a strong like sense of identity for them, and thus kind of like the betrayal is like quite deep. Compared to maybe somebody who comes in and being like, well, I know this like university isn't really going to protect me, and all right, it's not a surprise. I don't know. That's an empirical question, I suppose. I also like to kind of refine assessment of some of these constructs. This kind of, started out as like a theory-driven kind of exploratory measure based on survivors' experiences. And like there's been some like mixed psychometric stuff. So definitely looking for a psychometric consultant if anyone's interested. And then ultimately, like my goal is to kind of use this information to figure out how do we name and develop interventions that aren't just like targeting these individual factors, but how can we actually like kind of like frame some psychological interventions as these things that like disrupt these processes in the environment that have real influence on folks' individual psychology. So what does that mean? Because I love cats, I had to make that lab acronym. ChatGPT helped me figure out how to do that. In transparent disclosure of AI use, that is what I used AI for this presentation, which is a contextual approaches to trauma and sexuality. At least in my interactions with both undergraduate and graduate students, a lot of folks have been really interested in this topic. So I imagine hopefully that's going to recruit a diverse group of graduate students who want to apply this concept, not necessarily only to sexual violence, but other types of stressful events like discrimination, bullying, negative healthcare experiences, police violence, those types of things, where this same process is quite relevant. And ultimately, consistent with scientist practitioner approach of like how do we bring this into a therapy room, as well as a land grant mission of a university, which is hopefully how do we use this knowledge to actually like change local policies and improve the larger community. Alrighty. I will close with this quote, which is really when a flower doesn't bloom, you fix the environment in which it grows and not the flower. So I will thank my team, including my graduate advisor, Jennifer Fried, as well as my postdoc advisor, Lindsay Orchowski, and those logos and funding and stuff. And I'm happy to take your questions. Yeah.
The time points, what were the intervals?
Oh, that would be helpful. Yeah, the x-axis is terrible. Yeah, label your graphs well, guys. This was like our first survey, and then it was 3 months and 6 months later. No, 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 no. I could, yeah, I would be probably limited in my sample if I was trying to catch some folks in there, unfortunately. But I did look at differences in like timing since assault, and there actually wasn't any differences in distress.
So the no campus sexual assault, was there like an index from or something like that for the non-sexual?
Oh, I asked them. Oh, yeah, that's a good question. I asked them to like link it to the most stressful or distressing event that they've experienced. Not perfect, but yeah.
By the way, I'm happy to see that it takes the version of stuff that we did in our lab, which is encouraging, scientifically encouraging. I hope you go back like slide. further back. Very first data slide you had.
Data. This one?
Yes.
Okay.
Same kind of reaction where it's what we grapple with. It's like high versus low, institutional trail, low trail, you know, lower P scores. That the legitimate complaint we always give for reviewers that we try to grapple with is the causality issue that you cite. Is it the case that people were less distressed or seeking out fewer resources, fewer emotional support, and so they've had less opportunity to be betrayed?
Yeah.
Maybe experiencing a lot, but then they receiving a lot of resources are going to have a fair likelihood of some of those kind of adverse experiences. The way we try to get at it, but we're always underpowered, is trying to figure out like how to compare apples to apples, like how many places did you disclose to, what types of places did you disclose to, what were those experiences like, and so I'm just kind of curious about whether what it look like in terms of types of disclosures to the institution and differential experiences thereof.
Yes. One will be my like generic answer, and then one will be my slightly data supported answer. My like kind of common sense answer is like, I wish there were enough people talking to the institution for me to actually be able to examine that. I feel a little bit more, not that I separated this out because I couldn't because of like, power and stuff. But I would say the vast majority of these people who endorse institutional betrayal are endorsing some of these like omission acts of like they created an environment in which like this experience seemed normal and they're not actually like directly interacting with service providers. So that is my one like general thought. But then my data driven, and I'm trying to remember the exact. So I did one paper a few years ago that tried to like separate this like omission and commission pieces, essentially to like examine barriers to reporting. So I was like, all right, folks who have institutional betrayal and high rates of like post-traumatic stress, they might have barriers to like they're gonna have barriers to reporting. But I was like, wait, in my measure, I'm trying to kind of including reporting, and I was like, I don't know how to do that. Anyway, I kind of probably not awesome psychometrically, but essentially I took out like the pre-assault, the pre kind of disclosure items of institutional betrayal, and found that those were related to like barriers to disclosing. So if folks are having these kind of omission acts, these more climate environmental things, they are reporting higher levels of post-traumatic stress and greater barriers to reporting. So I'm not actually sure, like it might kind of, I need to examine this, but it might kind of cancel out. Like I'm sure folks who are distressed are going to seek services, and also folks who are not seeking services because they're afraid that they're going to be treated are also really distressed. So it might like cancel out when put together. Yeah.
Policy was a big question. Everyone's branches, but what your thoughts are. I'm not convinced. I know we have a chance to talk about it today, that the great majority of faculty, staff, and students actually know what their reporting mandates are or aren't.
Oh, absolutely.
Seeing policy from Trump and like how that's really making it work even for people who are aware of these things. I'm really excited to see ideas that you all have about institutional courage. And I guess the thing I'm wondering about is how you all are approaching like getting people on board and engaged with this effort. I do think that that's a huge difference, and I'm encouraged by the existence of it. And I guess I'm just kind of curious about engagement.
Yeah, I feel like it's like kind of a two-pronged question, right? Of like, okay, what is like the policy that is most helpful? And then it's almost like an implementation problem of like, maybe we have a good policy and no one knows about it, or like faculty, I have no idea about it. And in general, kind of there's a bit of agreement that like strict mandatory reporting is not super helpful and is not like victim-centered, and potentially even if that policy were to be enacted, like faculty are still really confused. So like what I would like to do, and again, this is like leveraging, this is where like the courageous leadership comes in, is like if like a leader at the university was like, you need to go through this like active training where like you have to engage, you have to practice disclosure, like you have to rehearse it and you have to show up. Otherwise, I don't know, something actually bad will happen. I'm like, I need like to leverage that power for this like implementation piece. And I'm not really sure how to do that. But I'm wondering, thinking about it. That's it. Yeah.
That might thinking of like kind of remind this came from institutional courage. So we know that relationship to like perpetrator, that closeness, acquaintance versus close, that relates to how. And this is probably speculative, but
That's fine.
like the closeness of that corrective institutional courage may relate to outcomes. I'm thinking of like, think somebody goes to an RA and they have a experience that's really supportive versus they hear a message from a dean of their college. Are those going to be kind of move the needle the same way? I think I can think of an argument both ways. I was curious.
Yeah. That's a good question. And I would say like it's an empirical question that I would be very interested in knowing, but I was like, I don't even think I've like, I ever was going to use this little pocket slide, but I included a couple of quotes because I was trying to decide like what qualitative quotes to do. And I was like, I didn't want to choose. But this one kind of speaks to this is like, okay, so this person said on the right, it's interesting because when you have to report it to the dorms, the person was actually the most helpful. And then as we got higher up, according to the Greek life or the dean of students, they offered less support, just like you would assume that they would. They said like, we'll handle this immediately, but it didn't seem that urgent to them. So I would like, this is kind of like, an illustration of like how we can kind of have different experiences in different aspects of the same institution. And also that next question would be like, at what level is that most impactful? Yeah. Oh no. Yeah. Figure out what's going on in your institution, I would say. Yeah, I would say, yeah. Anonymous incentivized surveys. Yeah, yeah. Yeah. That's yeah.
Like come up against kind of more harmful social reactions, and then are also probably taking like a lot of the brunt from institutional betrayal. Is that something that you've looked at? I know that your sample is white, but is that something that you've looked at or have interest in?
Yes, absolutely. Sample super white. But there's pretty good evidence. I mean, there's been some work that shows folks with, in general, like minoritized identities experience higher rates of institutional betrayal, and essentially that like this is not distributed equally, and may interact with that really outer level that's very hard to capture in empirical research. And there's like been some work that I think like is upsettingly like kind of combining like racial minority identities together, but it provides some evidence that like they're experiencing higher rates of interpersonal violence as well as these social reactions and institutional betrayal. But there's also a really great like an offshoot of some of this theory that a colleague of mine, Jennifer Gomez, does. And she's at BU School of Social Work, but basically she looks at like betrayal, especially within within race sexual violence, and kind of maps these like binds onto like difficulties navigating like essentially these like so like within folks, like for instance, the Black community, they have to like really kind of be connected to each other to like isolate themselves from like bad stuff in the society. And potentially when violence occurs within that community, like what do you do? And that's really difficult, particularly when there's stereotypes about Black men and sexual violence. So being a Black woman experiencing that in the community, it's like a similar bind of like, what do I do? And I can't really escape this. I need my community. So yeah, she does some really good work, especially in relation to race. Yeah.
Have you seen the broader effect
Ooh, of sexual assault.
victims that like the prototype of what most people believe sexual assault to be, experiencing like less institutional betrayal or having greater access to resources in comparison to victims that are not?
That's an interesting question. I would hypothesize, like, yes. And I think there's like not so few, but a minority of folks who experience the like stereotypical sexual violence that I actually like don't think I could test this with this data. But that might be a really interesting like future direction. I hypothesize that it would. And I think there's been some discussion. I don't know if there's empirical research on it, but I know it's been in like several discussion sections of, in particular, like same-sex sexual assault and experiencing institutional betrayal related to folks' services or policies around sexual assault, and like not having inclusive language around these policies or resources and not knowing how to navigate that. So that's definitely an issue that's brought up of like, this is essentially institutional betrayal. You're saying that this experience doesn't matter.
Any other questions, Doctor? All right, we'll call it. Thank you.
Thank you. Thanks for listening.